chain of infection. In my previous session, we have spoken about what is the chain of infection, what are the elements forming the chain of infection. Today, we will be looking at how to break this chain of infection. In other words, how to achieve control over a disease, how to reduce the number of new cases of the disease. So what I mentioned just now was the word control. What do we understand by the word control, especially with reference to communicable diseases? When we talk of control, we need to remember few things. And what are those? We need to look at when we achieve control of a disease, we are trying to reduce occurrence of new cases of the disease in the given population. In other words, we are trying to reduce the incidence of the disease. Incidence is nothing but new cases occurring in the population in a defined period of time. So, we reduce incidence by achieving control of a disease. The next thing which happens is, control will enable the disease process to halt in the individual who is affected. The duration of the disease will be reduced in the affected individual. Consequently, the risk of transmission of the infectious agent from the affected individual to the susceptible host is also reduced. So, shorter the duration of the disease, lesser is the risk of transmission from one person to other. So, that's another important element of control. When we are sick, we feel physically unwell or psychologically we feel down, and this sometimes can result in complications if the disease is not dealt with in time. So, by achieving control of the disease, we can minimize the physical, psychological complications which the disease may bring in if not tackled with. And lastly, it also reduces the financial burden to the community or the country. What happens is, when we fall sick, we go to the hospitals to seek treatment. So there is cost involved in treating one diseased individual. And if we look at the bigger picture, if many people in a population fall sick, it definitely puts the healthcare system into an extra burden, because then the treatment costs go up. So by achieving control, we also reduce the financial burden to the community and the country. The other part of financial burden also means that when we talk about sickness or disease, we take absence from our work or regular duties, which indirectly is going to affect the finances of the country. So by achieving control, we can reduce financial burden. So the 4 points to remember are, by achieving control, we reduce the incidence of the disease, we reduce the risk of transmission of the disease, we try to curtail the physical, psychological complications of the disease, and lastly, we try to reduce the financial burden to the community or to the country. Now, these are the principles of control. Let's look at how actually do we achieve control. Now, when we are talking of disease control, we also need to look at two other terminologies which sometimes are used interchangeably but wrongly. They are two E's, elimination and eradication. What do we understand by elimination? Elimination means cessation of survival of the infectious agent in human host. So the infectious agent should not be able to survive at any time in human hosts. That is elimination. Then what is eradication? Eradication is complete disappearance of the infectious agent from human, animal, plant and any other sources or reservoirs. So that's why we need to have an understanding of chain of infection, because the words which I am using with reference to these terminologies all are linked to the chain of infection. So this is the difference between elimination and eradication. Eradication, in other words, is also known as tearing off by roots. So you terminate all transmission of the disease by removing the infectious agent from any source or reservoir in which it is likely to survive. Right. Now, how do we achieve control of a disease? There are various methods by which disease control can be achieved. And for different diseases, a combination of these methods is generally used. But an understanding of chain of infection will help us understand what methods can be used for disease control. Let's begin. The first thing which we discussed in a chain of infection was the source or reservoir. Now logically speaking, if we can eliminate the reservoir or we can eliminate the source of infection, we can achieve a stop to the disease transmission. So if there is no source or reservoir, there is no question of the infectious agent being transmitted to the susceptible host. Now how do we achieve this? The best example I would like to give here is an example of dengue. How can I confirm that the reservoir for dengue is eliminated? Now for information, the reservoir for dengue is mostly it is humans and sometimes it is monkeys. Now how to eliminate the human reservoir? To eliminate the human reservoir, we need to ensure that all cases of dengue are diagnosed and treated adequately. So treatment of the affected individual is the way by which we can eliminate the reservoir for dengue infection. The next thing we can tackle it is not possible always to eliminate the reservoir in all cases. So the next step we can achieve is we can halt somewhere the transmission. Now that can be achieved either by taking care of the infectious agent or the mode of transmission. So if mosquito is the vector for transmission of a particular disease, now since we are speaking of dengue, we take the Aedes mosquito which is responsible, whose bite is responsible for transmission of the virus to a susceptible host. If the number of Aedes mosquitoes in a given area is reduced, the risk of transmission definitely is reduced, right? So if we try to reduce the development of mosquitoes or the breeding of mosquitoes in a given area, we can easily achieve control by reducing the risk of transmission. So this in epidemiology is also known as source reduction. So we are trying to reduce the source by trying to remove the vector from the environment. How do we achieve it? It all depends on to eliminate the breeding sites of the mosquitoes. So Aedes likes to breed in clean stagnant water. So try and avoid places whereby water will be staying over still for long periods of time. So if there are beautification ponds or fountains around your house, or there are areas wherein small puddles of water form around your house, you can make sure that that water is cleaned off regularly so that the mosquitoes wouldn't breed in them. So this is most of the times quite simple but not really thought of when we are looking at reducing the risk of transmission. So we have achieved two steps. Either we eliminate the source or we take care of the mode of transmission by looking at the infectious agent and the vector in this case. And lastly, what we can do is we will look at our susceptible host. If we can protect the susceptible host from getting infected by the infectious agent, that again can be a very important step in disease control. So in case of dengue, how can we protect the susceptible host? Protection of susceptible host in dengue basically includes protection from the mosquito bites. And to do that, there are quite simple things which can be done, like you can apply mosquito repellents or you can use insecticide treated bed nets in order to reduce the contact between humans and mosquitoes. So these are three things by which we can break the chain of infection at different links in order to achieve disease control. In addition to these, apart from the chain of infection, notification, legislation and surveillance are important steps to be taken as a healthcare professional in order to achieve disease control. Notification means the disease which is to be notified from a healthcare facility or from a community to a respective authority has to be done in a specified period of time and in a particular manner in which it is supposed to be. Legislation is additional to notification, or it is rather complementary to notification, because a person who is responsible and who is supposed to notify a disease does not do that, he or she is liable for legal action. Now this is kind of a check kept for improving the notification process. The next thing is surveillance. Now surveillance is, in other words, information for action. We collate all data, all information about a particular disease, try to analyze it and try to look at the time trend of that disease. And we keep on scrutinizing the changes in the disease over a period of time amongst the people in which we are studying and in the specific locality in which we are conducting surveillance. If we find the number of cases are suddenly going up, we need to look at what action we need to take in order to achieve control. So these are 5 methods of control, of which the first 3 basically target the chain of infection, and the next 2 are mostly administrative in nature. We talk about notification, legislation and surveillance. So that's all from me today. Please give your comments and do subscribe to my channel. Thank you very much. Have a nice day. Bye-bye.